What if your pregnancy didn't go as planned? Maybe the delivery gets complicated or your baby needs special care in the hospital right after birth. These aren't things we like to think about, but when it comes to healthcare in Singapore, even a short stay in the hospital can rack up bills quickly. If you've ever wondered whether you actually need maternity insurance or if your integrated shield plan is already enough, then you're in the right place. Hi, I'm Fer from Dollar Bureau, a personal finance platform that talks about insurance, investments, and financial planning. And today, I'm going to break down the difference between a maternity plan and an integrated shield plan. So let's start with the big picture before zooming in into the details. To put it simply, maternity insurance is like a short term safety net specifically for pregnancy and your newborn. Integrated shield plans, on the other hand, are long term hospitalization cover that enhance your MediShield life. Both serve different purposes, and sometimes having both makes sense. But to really understand whether you need them, let's dive in deeper into what maternity insurance actually is. Maternity insurance is a plan you buy during pregnancy, usually around the 13th week, that covers unexpected complications during pregnancy and even health issues your baby may face early on. It doesn't last forever. Typically, it runs for the duration of your pregnancy and a couple of years after that. Think of it as a financial cushion made just for one of the most unpredictable periods in your life. Now that you know what it is, the next question is, what does a maternity insurance plan actually cover? For mothers, maternity plans covers complications that can turn a normal pregnancy into a medical emergency. We are talking about conditions like preeclampsia, placenta rupture, postpartum hemorrhage, or even stillbirth. Some plans also provide daily cash if you are hospitalized or a lump sum payout if the worst happens. And if you're wondering just how detailed the coverage can get, here's a snapshot. Pause to read. Some plans even cover postnatal anemia, inpatient psychiatric treatment, lactation mastitis, or infections that may arise after a C section. For newborns, the protection is just as wide ranging. A maternity plan may cover congenital illnesses like Down syndrome, heart defects, cleft palate or lip, and cerebral palsy, just to name a few. It can also cover conditions that many newborns in Singaporean hospitals face, like neonatal jaundice, premature birth, bronchitis, and even hand, foot, and mouth disease. If you want to see the full list of what some maternity insurance plans cover, I'll include it in the description below. But the main point is this: these plans are meticulously designed to give both financial and emotional peace of mind, covering scenarios you probably wouldn't even think to worry about until they happen. Without insurance, treating some of these conditions can add up to thousands, if not tens of thousands of dollars, especially if the baby requires intensive care. With maternity insurance, you're essentially buying a peace of mind, so you can focus on recovery and bonding with your little one instead of stressing about the bills. But maternity insurance isn't the only type of cover to think about. In fact, there's another big player: integrated shield plans. Now, what is an integrated shield plan? Every Singaporean and permanent resident is automatically covered under MediShield Life. That's our basic government health insurance. It helps with hospital bills in public hospitals, but it's mainly packed to B2 or C class wards. It keeps healthcare affordable, but it doesn't cover everything. If you rather have the option of a private hospital stay or at least an air-conditioned single or double room in a public hospital, you need more than MediShield Life, and that's where an integrated shield plan comes in. Think of MediShield Life as your default safety net. It'll catch you, but only at the basic level. An integrated shield plan is like upgrading that net into something stronger and more comfortable. You get more coverage, better options, and a lot less stress about whether your hospital bill will wipe out your savings. And because shield plans are meant to cover you for life, they are something you buy once and keep paying for year after year, usually with annual premiums. But here's where things get interesting. How do these shield plans actually work when it comes to pregnancy? Here's where many people get confused. If you think that your shield plan will pay for your pregnancy checkups, ultrasounds, or even normal delivery, unfortunately, that's not how it works. These are considered normal life events, so they are not covered. But shield plans can step in when things go wrong. If there's a serious complication or during pregnancy or even childbirth, like eclampsia or an emergency C-section, then your shield plan can cover the hospitalization bills that come with it. The limitation, though, is that shield plans only apply to the mother. They don't automatically cover your baby. Once your child is born, you'll need to buy a separate policy for them. So while shield plans are a powerful tool for managing hospital costs, they're not designed to take care of everything related to maternity. And that naturally brings us to the big question. If shield plans already cover complications, do you really need maternity insurance at all? The short answer is it depends on your risk appetite and your financial situation. If you're someone who wants a peace of mind, knowing that both you and your baby will be covered no matter what happens, then maternity insurance is a worthwhile investment. It can be a lifesaver if complications arise. A maternity plan can also convert into a life insurance plan for your newborn and might even issue a shield plan too. So touch wood, if your newborn is born with a pre-existing condition, maternity plans make sure that your child is still covered no matter what. But if you're comfortable taking on some risk, or if you're already prepared to pay out of pocket for normal pregnancy costs and rely on your shield plan for emergencies, you may decide it's not essential. There's no right or wrong here. It's really about how much financial risk you're willing to carry during pregnancy. And if you are considering getting one, you are probably wondering, which should I even choose? So, which maternity plan is the best in Singapore? This is something that I get asked a lot, because the truth is there isn't a one-size-fits-all best maternity plan. Some insurers focus more on covering the mother, while others put more emphasis on newborn conditions. Some plans may be pricier but offer broader protection. The right plan for you depends on your needs, your budget, and the type of coverage you want. The best thing you can do is compare a few policies side by side, and if you're unsure, speak with a financial advisor who can guide you through the details. I'll include a link in the description below to our guide on a blog on the best maternity plans in Singapore. So you can check that out right after this video. So, to wrap things up, here's what you need to remember. Maternity insurance is a short-term plan designed for a very specific stage in life, pregnancy and the first years of your baby's life. It's about giving both mother and child extra protection when things don't go as planned. Integrated shield plans, on the other hand, are your lifelong hospitalization cover. They build on MediShield Life to give you better choices and stronger protection against big medical bills, but they don't cover routine pregnancy costs. For most parents-to-be, the best approach is to make sure you have at least a shield plan first and then consider whether maternity insurance is the extra layer of protection you'd like. And if this all feels overwhelming, don't worry. Our financial advisor partners can help you figure it out free of charge. Think of them as your GPS guiding you through the maze of options. I'll leave a link in the description below if you'd like to chat with them. If you found this video helpful, don't forget to like, share, and subscribe for more practical financial tips. Thanks for watching. I'll see you in the next video.